Hello friends, I am Dr. Dilip as Rajpal. I am a practicing general and laser varicose vein surgeon. Varicose vein is one of the most common diseases which is misdiagnosed and very underdiagnosed. Varicose vein is a disease in which the veins of the legs become dilated and tortuous. So the patients usually neglect it, thinking that it's a very common disease. It's a day-to-day activity, and I am having since childhood. My family has it, my relatives have it, and we have a family history. That's why the disease is grossly neglected. So varicose vein is a lot of people have a lot of questions like how do I inherit it, what is the complication, what is the treatment we can offer, and most important is whether it causes any recurrence. So I'll explain about everything. The most important thing is the risk factor. So definitely the aging increases the risk factor of the same, because of age, because of daily wear and tear, the veins become damaged and the valves become diseased. It is more common in women than in men because of hormonal issues, because of pregnancy, menopause, and even OC pills increase the incidence of varicose veins. Obesity, obviously because of increased fat deposits, the veins are less supported and hence the veins become dilated, tortuous, and hence the valves become diseased, leading to varicose vein formation. Standing is being the most important reason for this thing. In today's date, most of the jobs are concerned prolonged standing. That's why the incidence become more and more common. So coming to familial component, almost 75% of identical twins will have varicose veins, and almost 52% of non-identical twins will have varicose veins. If both the parents have varicose vein, then almost 90% of the children will have varicose vein. If one of the parents is having it, then 62% of women and 25% of men will have varicose vein. So the incidence is that common. Coming to the symptoms, patient usually complains of lot of visibility of veins in the legs. Then comes a stage of pain, then swelling, then discoloration in the legs, and even ulceration. Ulceration being the most deadliest of the complication, because these ulcer happens because of increase in the pressure in the veins. So these ulcers, although they look very small or simple, but they ooze a lot and they don't heal. They refuse to heal. We usually follow SEEP classification, which is clinical, etiological, anatomical, and pathophysiological classification. According to that, we grade the patient, and according to that, the treatment is offered to the patient. Now, before coming to the treatment, I would like to highlight something about the pathophysiology, because I give a lot of importance to pathophysiology, because since the time patient doesn't understand how does varicose vein happen, so he is not critical and he doesn't take care of it. So varicose vein is one disease which happens only in humans because of our standing job. So because we stand. So anything in this world will come from above downwards because of gravity, but nothing goes from below upwards. So our body is one structure in this universe where actually blood is going from below upwards. So when this blood is going from below upwards and person's job is concerned with prolonged standing or family company, as I just mentioned, so some of the valves become diseased. Now when these valves become diseased, blood actually falls down. And when the blood falls down, the vein become dilated. So initially the veins will be visible. Slowly and steadily what happens, the pressure in the vein increases. And these are small superficial veins. They cannot bear that much of pain, that much of pressure. So the veins start paining. This pain is not a typical pain as in orthopedic disease. This pain is more of heaviness in the legs. And this pain, when patient gets up early in the morning, patient feels very comfortable because he was lying down, all the pressure in the vein decreases. But now as the day is ending, patient is working throughout the day, vein becomes more and more tortuous and this thing. So it's caused a lot of pain, more so in the evening. And patient has a feeling as if he should do massage or something like that. Slowly the pressure in the vein further increases, which causes the plasma, what is white blood of the blood, to ooze out, so leading to swelling in the legs. Slowly and steadily, even the red cell come out, leading to blackish coloration from the legs. If there is blackish discoloration, if the red cell ooze out, then there is something called inflammatory mediators get released, and patient has a feeling of itching, and patient scratches. And once patient scratches, patient develops an ulcer, and this ulcer never heals. So as I told you, the main pathophysiology of the disease is increased pressure in the vein. So the treatment is to decrease the pressure in the vein. Now how will you do that? Conservative treatment in the form of bed rest, keeping leg elevated, more so in lying down position. Once you do that, the pressure in the vein decreases. But throughout the day you cannot do that. So what you can do is, throughout the day you are supposed to wear specially designed stockings. Nowadays very good quality, very fine elastic stockings are available. We usually recommend class 2 stocking, which gives a pressure almost 20 to 30 millimeters of mercury. So once you wear the stockings, the pressure in the vein decreases. So obviously the pain, swelling, and other complication, that also decreases. In fact, the ulcer also heal. But the thing is, that is not, the disease is not going to get cured. The disease is going to remain static. The disease will not get prolonged. Now coming to the surgical management, if at all in today's, the diagnosis is done on the basis of venous Doppler, and on the basis of venous Doppler we diagnose what is the size of the saphenofemoral valve, saphenopopliteal valve, ankle perforators. In today's we ask for even the size in millimeters, what is the, because the treatment we are doing more and more non-surgical treatment in the form of endovenous laser ablation. So all that is very helpful. So one is of course as I told you, the treatment, the veins, the valves are diseased. So surgically we can either cut the valves at we can just disconnect the superficial and the main vessels. But this has to be done at multiple levels. So it is painful, and these wounds itself doesn't heal because of the pressure in the vein. Leg is already swollen and the pressure in the vein was already high. Now coming to endovenous laser ablation, what we actually do is we put in a small needle inside the vein. Inside the needle we put in a laser fiber and completely burn out the vein from inside. This complete procedure is Doppler guided. So this complete surgery in fact is done under local anesthesia. It is a OPD procedure. Because we do OPD procedure, the patient can immediately walk down and can resume his normal activities very next day. So it causes very less morbid than today's day. The most important treatment is to decrease the pressure in the superficial vein, and that is taken care with the help of endovenous laser ablation. Yeah, coming to the recurrence part, lot of patients have question regarding recurrence. See, now this disease is valves related disease. So any valve which is diseased, we have to take care of that. So the valves which are diseased, we are ablating with the help of laser, we are taking care of that. But tomorrow patient is not going to change his job for a particular disease. Some new valves may still get disease. Now many a time both the veins, that is long vein and short vein, both are diseased. So in such patients we ablate both the veins, the chance of recurrence is almost nil. But if at all one vein is diseased, there is always a possibility that patient may still develop. So in such patient, if patient is already operated once, more than once, then we recommend them to wear lifelong stocking. Otherwise the stocking is recommended only for 3 months. Now if you compare whether this is a laser and open surgery, the recurrence rate for both is almost same. However, in open surgery there is lot of morbidity, lot of pain, suffering. But in laser ablation, it's OPD procedure, it can be done local anesthesia, patient can resume work very next day. So morbidity is absolutely nil. So if you want to get more information, then you can go to Lybrate page. Thank you.